Hi everyone, my name is Joshua McLaughlin. I'm one of your digital media gurus here at the University of Sussex.
My name is Pai Opalita. I'm a third year student.
And today we're making a video on the recent COVID-19 preventative measures that have been put in place for the Brighton and Hove City area and why these are incredibly important for students to follow.
I'm Emma King. I'm an acting public health consultant at Brighton and Hove City Council.
I'm Katie Cuming. I'm a medical doctor. I'm a public health consultant working here in the city. We're working all over the city trying to do as much as we can to prevent COVID-19 from spreading further.
Fantastic, such a valuable job to do.
The first question is, how can students help Brighton and Hove remain a safe place to live during a pandemic?
Firstly, I wanted to say thank you to all the students out there. I know it hasn't been easy being at university this year, but I know so many of you have been super responsible with doing the right thing and following the rules. Cases have more than doubled over the last week in Brighton and Hove. We are seeing this rise largely in younger people, but we are seeing it across all age groups. What we know from local test and trace data is that this is the result of people mixing from other households.
One of the main things is keeping that physical distance. So sticking to 2 meters in as many situations as possible. And if for whatever reason you end up closer to someone, making sure you're doing other really good preventative things like wearing a face covering.
Washing your hands, as you well know, and sanitising. And also keeping surfaces clean. Whenever we get symptoms, we need to isolate ourselves and we need to get a test as soon as we can. And isolation, as annoying as it is, it needs to be both not leaving the house and no one coming over. If you are a case and you get that confirmed test result, we ask you to isolate for 10 days. And if you're a contact, we ask that you isolate for 14 days. And this is a complete given. So often people get confused and they think, oh, I can go and get a test, and if it's negative, I can return to normal life. But this is absolutely not the case. It can take up to 14 days for the virus to develop in your body and to make you unwell. So if you get a test early on, it might be that there isn't enough virus in your body yet for the test to detect. The thing that we can do isn't perfect, but it does provide a layer of protection. And if we layer them all up together, we get better protection from the virus.
I mean, that sounds fantastic. And I'm sure it's something that we're all pretty well accustomed to right now as well, but it's really important that we keep it up. I suppose the second question is what your biggest concern is with protecting the most vulnerable within our city.
As people get older, they become so much more vulnerable to COVID-19. But we also know that for lots of people with health conditions, they're at increased risk. Lots of people whose job out there means that they're looking after us. They're at a lot of increased risk.
The more cases we have in the city, the harder it becomes to protect our vulnerable people. You may think, oh, I'm just seeing young and healthy people and it doesn't matter if I pass it on to them. But you don't know who that person is going to come in contact with.
The other groups, of course, that we really worry about are those who, because of their ethnicity, have been shown to have a higher risk of getting sick and dying. By all of us doing what we can to reduce the risk of high rates of COVID in the population, we reduce the risk of those more vulnerable people getting infected.
Speaking of limiting contacts, it's linked to the third question, like why it's important for us as a student to stick to the rule of 6.
The rule of 6 is the law and we all need to stick to it. But what I wanted to talk about was a slightly different way of thinking about it. In one day, you could stick to the guidelines and you could meet 5 people for breakfast, 5 other people for lunch, 5 other people for dinner, and you would still be sticking to that rule of 6. Each time you come in contact with another person, you're increasing your risk. If you think about that 2 days where you might not know you're about to get COVID because you don't have symptoms yet, but you're still able to pass it to other people, you could potentially pass it on to many of those.
Think about socialising outside if you can. Think about socialising in well-ventilated places, but don't socialise with a really big group of people. For most of us living and working in Brighton, it's absolutely great that it's a university city and that there's loads of young people and it's a really social place to be. We all want it to carry on, but it does feel as though right now, with cases increasing in the way that they are, it is really important to sort of all play a part.
Thank you so much for all of this. This is incredibly useful information that we should all be following because ultimately it can save lives.
Even if we meet just for 2 or 3 people, we're still increasing the risk of getting COVID.
Thank you guys so much for watching. Stay safe and we'll see you soon. Bye.